So, good morning and welcome, everybody. Honorable Minister, ladies and gentlemen, dear friends and colleagues, welcome to this session on unlocking debt swaps. I really appreciate everybody who is here this morning, third day of the conference. I know everybody is a little bit tired, but we made it through the heat and the traffic. So delighted to see you all here. We do believe that the question of debt swaps is a very important one. It has been discussed already at the conference in many different sessions. We are quite aware of that, and I try to attend as many as possible. Because indeed there are many different forms of debt swaps, and there have already been sessions discussing debt swaps in climate nature, of also commercial debt and multilateral banks. There are the options of completely bilateral debt swaps. Today we will be discussing all these options, but also the option to involve a third party international organization as another option. And obviously the kind of focus on debt swaps was very much emphasized by the wonderful announcement of the Spanish government yesterday, and we are delighted to have you here as Director General from the Spanish Ministry, because the launch of the global hub for debt swaps and development, I think, is a really critical step, and I'm sure you will talk a little bit more about that later on the panel. So we needed something like that to facilitate debt swaps, to manage that, provide a platform so that it can be applied more broadly. Because I think that has been one of the issues that's also mentioned in the outcome document, that the goal is, of course, to kind of learn from the experience and then to help to scale it up and to encourage also more countries maybe to use this instrument. And that's also very much the purpose of this session. Learn from the experience, and we will hear from various speakers who really have in-depth experience with this type of debt swaps. Analyze a little bit, what worked, what did not work so well, so that we can learn from, shortcomings, but then very much to make it a forward-looking session. So, how can we contribute to scaling up this? How can we encourage more countries? And very importantly, and I will ask the panelists later on, to comment on that, one of the issues that has often been raised is, debt swaps are complicated. There's a lot of transaction costs. It's not easy for countries to engage. So that's a key question for us. How can we make it simpler? How can we have templates that countries can use based on the existing experience? So that's what we will be discussing. And I hope today we will really also have the opportunity for discussion, and including the audience. We will only have one panel, not two. So hopefully you can all participate in the session. And of course, I forgot to introduce myself. I'm Prof. from the JLI Center for Global Health Diplomacy, and we had the honor and pleasure to organize this side event together with the government of Indonesia and with the Global Fund, and both teams, of course, are here. So, with that, it is my distinct honor and pleasure to welcome our first keynote speaker, the Honorable Deputy Minister of Finance of Indonesia, Professor Nazara. We are delighted to have you here, and I welcome you to the podium to deliver your keynote speech. Mr. Peter Sands, Executive Director of the Global Fund, Dr. Christoph Ben, the Director for Jogland Institute for Center for Global Health Diplomacy, colleagues from the government of Germany, government of Spain, and also, ladies and gentlemen, very good morning. It's my privilege to address this session in the middle of the 4th International Conference for Financing for Development. And this session we will talk more later about the debt swap. The debt swap is something that's already been one instrument of innovative financing solution. And I'm very honored to share some of the Indonesian experience about the debt swap, and later on my colleague from Indonesia, former DG at the Ministry of Health, will elaborate more on the detail outcomes as well as the detailed technicalities. But let me use this opportunity once again to reflect on what we have in the global world right now. I can say that the global economy is not at its best. It is very challenging at this time around. And sometimes the challenges are really multi-dimensional. And not only that, it is multi-dimensional. Sometimes in lots of circumstances, it is overlapping. So it's not only multiple, but also overlapping situation, overlapping crisis, geopolitical tensions, trade wars, health risks, pandemics, climate-related disruptions, to mention a few. In Indonesia, we look at our state budget as a shock absorber that that serve as an absorber for all the international shocks as well as the domestic shocks, and we use our state budget to protect the people so that we can continue to make the best out of the state finance for the people of Indonesia. We continue our commitment for the sustainable economic growth. We continue our commitment for the infrastructure development. We continue our commitment for the SDG. And I can also mention here that despite our strong economic performance, the first quarter this year our economic growth was around 4.9%. And just recently, a couple of days ago, our latest inflation is 1.9%. So it's despite those indicators, but in terms of the fulfilling the SDG, we only have like 5 years to go to fulfill all of our promises to the people on the sustainable development goals. So it is very important in order to answer to this challenge. We have to think about the resource mobilization. We have to think about the diverse and innovative financing mechanism, and of course, the debt swap is one of the innovative financing that we continue to look at, continue to do. Now, the current situation also shows us that the post-pandemic time, many countries actually end up with high debt stocks and also limited fiscal space. But the challenge for this country is the rising debt servicing and at the same time increasing demands for the public investment. More number of people, more public investment is needed, but then challenging fiscal space in lots of the countries, especially after the pandemic. Now, it is very important that the financing strategy has to be very, very comprehensive and prudent. In Indonesia, we are doing the diversification of funding sources. We mobilize the domestic resources. We deepen our capital markets and find new innovative financing mechanism, including the debt for development swaps instrument. Now, I can see that the debt swaps instrument can serve will benefit easing fiscal pressures on the one hand, and on the other hand, enabling investment in the national priorities. Now, let me describe a little bit of Indonesia's experience with the debt swap. The first logic of debt swap in Indonesia was actually went back to 1998 during the Asian financial crisis. So at that time, Indonesia was on the transition of administration from the former President Suharto. It is a transition, not only political transition, it is economic transition, it is societal transition. And the debt swap was included in the what we call the Paris Club Memorandum of Understanding. That is a collection of Indonesian dollars at that time. Debt swap is included in that memorandum, and then the first debt swap that conducted by Indonesia was in 2008 with the government of Germany. So that was like more than 23 years ago. The first time Indonesia with the government of Germany conducted the debt swap on education. And then several education activities after that also went through the debt swap, and we recognize the debt swap as an innovative financing instrument. From that time until now, Indonesia has secured 15 commitments on the debt swap program, and involving several bilateral creditors such as Germany, United States, Australia, Italy, and the values of the swap ranging from 6.5 billion US dollar up to 85 billion US dollars per transactions. And this is something that very encouraging. And let me take a couple examples from those 15 recent, no, this is not recently. In 2010, we have debt to health initiative supported by the government of Australia and the government of Germany. That is 75 million Australian dollar to support health-related projects, particularly in combating diseases such as AIDS, tuberculosis, and malaria. And we believe that has already improved the health outcomes of Indonesia. With more specifically with the government of Germany, we signed 3 debt to health swap agreements in 2007. So this is also one of the very early debt swaps initiative that we conducted. 2007 for 50 million euro. 2021 another 50 million euro to bolster tuberculosis activities in Indonesia, and most recently last December 2024, we entered into 75 billion euro debt swap agreement again with the government of Germany to be channeled through the Global Fund to combat tuberculosis and malaria, and also supporting the resilient and sustainable system for health programs. And of course, if you ask what are the lessons learned, I can find 5 lessons learned. So bear with me there. I'll try to be as concise as possible. Number 1, debt swap is possible if it is aligned with national priorities and system. It is very important right from the beginning. It is there on the government documents. It is that will make that the interministerial work, interministerial cooperation can be conducted in a smooth manner. In Indonesia, we have the country coordinating mechanism, and for the health, the Ministry of Finance, because the debt management office is with us, and the Ministry of Health, because a lot of health outcomes, health programs are with the Ministry of Health. We conducted a very close in-country coordination mechanism. So that is number 1. Number 2, it is very important that the country improve from time to time its institutional capacity and governance. This is very important because transactions will require multi-stakeholder understanding and multi-stakeholder agreement. Despite the fact that Ministry of Finance is taking care of the debt and the technical ministry is taking care of the education or health or transportation and so on. Lesson number 3, it is very important to come up with a simple but effective design. There is no one single design that can be applied to every single country. Even for the country like Indonesia, for health and education, there may be some differences in the design. That should be okay. but the end goal should be still there. That is, it's very important to have simple and effective design, and that will make possible the monitoring and evaluation frameworks of the network. Lesson number 4 is the community and stakeholder engagement. Let me take an example about the health. Health, yes, there is a Ministry of Health, but health activities involves not only the Ministry of Health. There are local governments, there are central governments, there are NGOs, there are many other agencies that should be part of the comprehensive understanding what is the aim of the next one. And lastly, it is very important. My last lesson is the acknowledgement from other lenders. So event like this is going to be very important for us to continue to discuss, to talk, to recognize what the creditors has already been done, what the borrowing country has already been done, and this will make the better debt swap in the future. So, ladies and gentlemen, I believe that in closing, we have already seen, we have already done the importance of the debt swap, and as a member of G20 and also as the co-chair of the G20 Joint Finance and Health Task Force, Indonesia, we have already contributed to the recent G20 and UNCTAD study, which examines the potential of the debt for health swaps. So we are making the best promotion for this debt swap. And I believe that this can be replicated for other sectors: climate change, transportation, food security, green transformation of a country, and what have you. And Indonesia will remain open for sharing our experience. Later, my colleague will share with you the technicalities, and we are looking forward to strengthen the partnership with many international organizations and also donor countries in the world. Finally, I would like to express my sincere appreciation to the Global Fund and also Juplang Institute Center for the Global Health for convening this important dialogue. And I believe that the future of debt swap is one way, one instrument that we can work together for the better use of for better global public goods. I believe that we can work together on this. We can see new avenues for the new financing, private financing between the borrowing and also the lending countries. Thank you very much for your attention.
Thank you so much, Minister Professor Nazara. I think you will all agree with me that this was an excellent introduction to our session. We could not have asked for more because Indonesia is clearly a pioneer in debt swaps overall for more than 25 years, in different sectors involving many different, partner governments. So we already learned a lot from that experience, but you also were looking forward, how this can be promoted. And thanks for your leadership in the G20, and you mentioned indeed UNCTAD, the UN agency that was quite involved in the debt swap conversations facilitated by the government of Brazil when it put the debt swaps on the agenda last year. And they have just come out with a report on debt swaps, I believe, just last week. So there's new data on that available. So all of that I think is coming quite nicely together here in Seville. So with that, I would call upon our second keynote speaker, Peter Sens, Executive Director of the Global Fund. Welcome, Peter. Pleasure to have you here. And as many of you might know, Peter, of course, is the Executive Director of the Global Fund. But before that, he was the CEO of Standard Chartered. So it's one of the CEOs of international organizations who knows a little bit about debt mechanisms, and that might help for our conversation. So delighted to have you here, Peter, to give you a perspective on debt swaps and this institute. Thank you.
Thanks. I might do the same. I will follow the example of His Excellency, the Vice Minister, Dr. Nazara, and thank you, Christoph, for the introduction. First of all, yes, a confession. I'm not a clinician or a scientist. I'm a banker by background. But then again, so is the Minister of Health of Indonesia. And you may draw a lesson from that. If you want to do debt swaps, it kind of helps when you have people who understand the technicalities of it. Another thing, for those of you less familiar with the Global Fund is a public-private partnership. It's the largest multilateral provider of funding for health to low and middle-income countries in the world. We disperse about $5 billion a year. Most of the money we disperse is in the form of grants, but we also do debt swaps, blended finance, and so on. Why do debt swaps matter? Well, it's because, to be honest, there isn't enough grant finance out there. Simply not enough to meet the massive health needs across the world. And debt swaps provide a mechanism for unlocking more resources. They're very simple to describe. Essentially, in the bilateral form of debt swap, the creditor cancels or repurposes all or part of the loan in exchange for a commitment from the borrower, the government, to use all or part of those proceeds for a development priority. Where does the Global Fund come in? The Global Fund comes in as a mechanism through which those proceeds can be channeled, which provides the creditor with the assurance that those monies are going to be used in a way that delivers those development, in this case health benefits, with all the associated financial reporting and assurance requirements that the creditors are used to. This is a model that we have used very successfully in a number of countries. We've now done 14 debt swaps, of which one of the most recent is the one that the Minister referred to, the 75 million euro debt swap between Germany and Indonesia. We've also recently done one between Germany and Mongolia, but we've also done ones with Spain. And it's important that we don't just get focused on the numbers. Behind the numbers are the impact on people. So in Cameroon, for example, as a result of the debt swap we did with Spain, there are 30,000 people receiving HIV treatment as a direct result of that debt swap. In Indonesia, which has seen fantastic improvements in TB diagnosis and treatment, part of that has been fueled by debt swaps, particularly with Germany. So it's, at one level, the headline numbers are interesting, but what's really interesting is what difference it makes to health outcomes in the countries. A few lessons that we've learned, and many of these will echo what the Minister has already said. First, we can't approach this, to use an English expression, as a hammer looking for a nail. The wrong way to go into debt swaps is to say, we've got this really interesting debt swap thing, let's kind of find something to use it for. The best way of doing it is to be very clear about the strategy, the health strategy in this case, the needs of a country, how it fits into the overall financial management debt strategy, and make sure that a particular transaction makes sense within both those contexts. It's got to fit what the finance ministry is trying to do. It's got to fit what the Ministry of Health is trying to do. And there's a little too much of sort of enthusiastically going out and selling this as a recipe for every situation, regardless of that. The second thing I would say is debt swaps are not going to get countries out of severe debt stresses. They are on the margin helpful, but they're actually not a substitute for debt restructuring. So the primary focus of them has to be on what difference they can make to the health or border development objective, acknowledging that on balance they will also be helpful for a debt restructuring context. A third is this point, and I think this is another way of talking about the sort of institutional capabilities and things. One of the first tests we have when we look at potential countries for debt swaps is does the Ministry of Health and the Ministry of Finance have a good collaborative relationship? Because it is almost impossible to make a debt swap work if they're fighting each other. And unfortunately, in some countries, the relationship between the Ministry of Health and the Ministry of Finance is a little problematic, let's say, including many rich countries. One of the things that makes Indonesia distinctive here is actually the level of understanding and capability and trust between the Ministry of Finance and the Ministry of Health. And that makes it much easier to do these kinds of transactions. Another lesson, and this is where I do think the Global Fund comes in, is when I look at some of the debt swaps out there, including some of the ones for climate, the transaction costs relative to the amount of money being released are extremely high. There's lots of intermediaries and lawyers and new structures and things like that get involved. And actually that all takes money out of actually delivering the outcome. One of the advantages that we can offer around these things is we are already running very large programs agreed by the governments in these countries with established implementation mechanisms. And we already have, for every country in which we operate, what we call unfunded quality demand, which is requests that the countries have put forward that have been through independent technical review, but that we don't yet have money to fund. So we can literally say, we have off the shelf something that's part of the national strategy, something that's been under technical review, and this is a package we just need to put money into. And it can go through all the established financial assurance, financial control, independent audit, and all that kind of stuff, mechanisms that we already have in place for, in every case we've done so far, significantly larger sums of money that we're using for the debt swap. So we can leverage off the back of it. And that really reduces the transaction costs of doing one of these things. A final lesson, though, I would say is this isn't going to remove the need for grant flows. We should try and get more out of debt swaps, and not just bilateral debt swaps of the nature that we're talking about here, but public market ones that use guarantees to refinance existing debt. They too are an opportunity. But we should also recognize that this isn't going to work for every country, particularly for the very poorest countries and for those afflicted by conflict. It's very difficult to make a debt swap work. It works in places where you have established institutional infrastructure and capabilities, and we should definitely use it for those. And in a way, the more we use it in the places where we can use it, the more it frees up scarce grant resources for the places where this kind of mechanism is going to be very, very difficult to implement. So we shouldn't see it as an alternative to traditional grant ODA. We should see it as a complement. But I do want to compliment Indonesia for really being a pioneer on this and for demonstrating how it can be made to work in different sectors and with different creditor partners. I think it's a very robust model that has been implemented. But I also want to acknowledge and appreciate the the creditor countries like Germany, like Spain, like Australia, that have done this. And there is a bit of a learning curve as to how to do this. But the more that we can make it a pipeline of transactions, and we're certainly looking at a pipeline of transactions right now, a pipeline of transactions through standardized kind of mechanisms, through established implementation arrangements, the more we can make this a really efficient and effective way of channeling incremental resources into health. So with that, I'll stop. I look forward to the panel. I'm going to have to step out for a few minutes and then I'll come back in again. Okay, thank you very much.
Thanks so much, Peter. Not only I think debt swaps are complementary to other forms of development finance, but also the two keynote speeches were quite complementary, I felt, from two different perspectives. So I think we are all set now for our panel. So I welcome, our four panelists to come up to the stage. Solange, Ines, Martina, Lisa, please welcome, join me here on the panel. We now go into more kind of practicalities, I would say, and you all will get, short questions. And I really hope that in this session we will keep some time for the audience to engage at the end as well. But I really would like to start with you, Ines Carpio, Director General for International Finance in the Spanish Ministry of Economy, Industry and Competitiveness. And indeed, I've seen you on several panels during this conference on this topic. But now, with the announcement yesterday, that was so important for everything that we are discussing here. So I would really welcome you to make a few comments on, you can come, of course, on Spain's role in the debt swaps and so on as well. But I think for the audience here, it's very, very interesting what you initiated, how will that look like, and how will that kind of include, the various kind of players, partners that are also represented here. Over to you.
Well, thank you. Good morning, and also thank you for giving us.
I've been told if you can speak up, because very close to the microphone.
Okay. Is it working at all, or should I just speak louder? I mean, I have a problem.
Otherwise, you use that.
Thank you. Well, thank you first for giving us, as host country, the opportunity to present and elaborate a little bit more on the proposal that we officially launched yesterday, and where a lot of countries and institutions are also joining us. I mean, it's not only a Spanish thing; it's like an international, multilateral initiative. So, from very, very short from our experience in Spain, we have been working with debt swaps, bilateral debt swaps, for almost 30 years now. We have implemented 47 operations in around 30 different countries and different sectors. So, I mean, we have a large experience, but just from our side. So, but we see, and we have heard already from Indonesia, from the Global Hub, of course, we're not the only ones here. So Germany has also vast experience, Indonesia. There are lots of countries and institutions that have been working for decades. And the lessons we learned, I think the Vice Minister summarized them very good, that these are useful instruments, of course, not the panacea. They will not solve the debt crisis, but it's an additional tool that we can add to all the tools that we need to manage the debt situation. And what we have learned is that we need them to be country-owned. I mean, I'm just changing the words, but really repeating what the Vice Minister said. We need them to be country-owned. We need a good capacity building, technical assistance, and we need a standardization that helps to reduce transaction costs, but at the same time allows for enough flexibility. So all in all, what we try to present with this hub is really building on existing experiences, organizations, agreements, to put them all together in a single way or place, to really have a shared knowledge platform where we can standardize legal templates, and also when countries or institutions are willing also to provide funds, the hub can provide then technical support for both debtor countries but also for creditors. So that's the idea of the hub. And of course, it's now open for everybody who has interest in joining, because we are now in talks with the World Bank to build that. But it's not that this has to be just a single World Bank thing. I was talking yesterday with other institutions, and they were asking, why didn't you count on us? And I was like, no, we do. We are waiting for your expertise to be brought also on the table. So I think that's a summary.
Great. Thanks, Ines. I think that clarifies also your vision for this hub, and I understand, it's in the process also of being built and bringing more partners and so on, but really a fantastic initiative. Congratulations on that. I will then go next to Martina. Martina Metz is the Acting Director General for Multilateral Development Policy, the German Ministry for Economic Cooperation and Development. And you already heard, Germany just recently did another debt swap with Indonesia, which is fantastic, but also with Mongolia last year. But it's fair to say, Martina, you have more experience with debt swaps than that, because our joint experience with debt swap was already back 18 years. Because we were both involved in the very first debt swap between Germany and Indonesia, when you were already in the ministry and I was at the fund at that time. So long experience with that. This question, as you know, is more about the experience so far, and I welcome also comment Germany's engagement with that hub, and that, so that we see that there are more countries involved in this Spanish initiative. So your experience and Germany's experience with
Thank you so much. Thank you so much for organizing this important event. I think it's really important to promote this instrument, the debt swap, debt to health, in this case instrument. And I would also like to thank Spain. I think this is a very, very important initiative. But I will come back to this when I will pose the second question. I understand also I'm very tempted to refer to your initiative now, but I think we will speak about what comes next and later. So let me refer a bit to the past. I will be brief because I think many issues have been mentioned already by the previous speakers, and I can fully underline what the Honorable Vice Minister said, and also the Executive Director, about what the debt swap is and what it is not, and what the core prerequisites and are. But just briefly about Germany's experience and where we stand. We have been engaging with debt swaps since 1993. So that's when we started to at least to develop the first ideas. And not only debt to health swaps, we also engaged in swaps in the fields of food and climate. So there are also green swaps. For us, what is very, very important, and it has been mentioned, but I want to underline it once more, that this is aligned with the country priorities and with the country development plans. So we tend to be flexible. We don't have a quota for health or for the Global Fund or for anything else, but we want to be as flexible as possible in order to align debt swaps with country priorities. That's the first thing I want to mention. Then how we operate debt swaps. The basics already had been explained by the previous speakers, but just to flesh it out again, it is, as it has been said, it's not a debt restructuring instrument. It is in first place. It is, and it's not, and we do not engage in debt swaps with countries which are in debt distress. because this is also one important prerequisite that countries that debt to health or debt swap partners still have a high debt servicing burden, which might impede constraints to the engagement in health services and in others and in other investment areas, but they still have this capacity. So in the case of a debt swap, this would mean that the country, our partner country, takes a certain amount which it owes to Germany, puts it into a development project or a project of a multilateral institution. So technically speaking, the partner country does not save money. That's why it's not a debt restructuring this way, but it benefits from this from the swap in the sense of a development booster. That's what our wording. That's how we see it. It's a development booster for specific relevant areas. It is, and it also has already been said that it's not. It complements other forms of cooperation, of course, and there are some countries where a debt swap does not apply. For example, in our case, for example, the least developing countries, we only work with grants with these countries, so there is no option for a debt swap, obviously. So this is another point I wanted to mention, and we coming to the option of to engage with the Global Fund or other international organizations. Again, for us, what is important is flexibility in order to align with partner country priorities. But swapping into larger broad projects of international organizations like the Global Fund has a couple of advantages, which the executive director already mentioned. And the most important is efficiency. And I think in times like these, where we really have to think even more than we did before about efficiency, how the best use of every dollar, of every euro, this is something which is really relevant. We don't have additional overheads from scratch. There is a track record we can build on, so there are clearly advantages to engage with the Global Fund or other international organizations. I think I stop here. I don't want to bore you with too many figures about our track record. I think what our latest swap, I think it's one of the largest electoral health swap so far as if I'm not mistaken, with Indonesia, was realized end of last year. And we are very glad that we have a strong partnership with Indonesia, also with different modes of cooperation, but also that swap. And I think this really contributed to support Indonesia in its health strategy, implementing its health strategy. And this is my last point here. I really want to underline this in order to ensure additionality. This is very, very essential. And I think this was the first lesson learned the Honorable Vice Minister mentioned, is that this is part of supports the sound development and sectoral strategy of the partner country. Then we can make sure that this is additional. And of course, the next prerequisite, which is relevant, it also has been mentioned, is a sound financial and debt managing strategy. My very last point is, and before we then come to the next steps, all of us so far have said it's not a debt structuring instrument. But of course, if more donors join and engage in debt swaps, it can be a debt distress prevention instrument. So there's no firewall between debt policies and debt swaps. I think this is also important to mention. This is a matter of scaling up. Okay, thank you.
Thanks a lot, Martina. Very helpful. And indeed, we'll come back to the kind of forward-looking final question a bit later on. With that, I hand the microphone to Lisa Munira. So Lisa is a health economist at the National University of Jakarta, and recently was the Director General in the Ministry of Health in Indonesia for health policy. But fair to say, also Lisa was involved in this kind of very first step to health swap that we mentioned between Indonesia and Germany. So we have a lot of kind of experience here at the table. So Lisa, you've been much more involved from the side of the Ministry of Health, technicalities in translating the death swap into health programs. So very, very good to hear your experience with that.
Thank you, Christoph. And I feel a lot of the points raised brilliantly by the two keynotes at the beginning really covered points that need to be covered by the panel and especially myself and also the two speakers. But I'd like to add perhaps a little bit. So Indonesia's gone through a number of debt swaps, 15 debt swaps in particular that the Vice Minister had already mentioned. This most recent one, the 75 million, is quite significant for a number of reasons. One, it's a trilateral agreement. So it's part of a series of the Debt Health trilateral agreement that the Global Fund has. It was pioneered actually in Indonesia with Germany and the Global Fund as the first trilateral in global health. So the process Peter Sands already mentioned is a process where the two countries identify concessional loans or the outstanding loans that need to be agreed upon, and then the Global Fund lends its process where both countries have already are very comfortable with this process and have vetted to it, and each negotiation or each debt swap is individually negotiated. What I'd like to highlight here is that there's a number of points that we can observe from the 4 debt to health swaps that Indonesia has done since 2007, that very first trilateral, to the most recent one, where you can see that, of course, the size has increased, the discount rate, as is the term for the debt swap for debt to health, where the first debt swap was a 50% discount rate, so the debt is cancelled upfront, and then 50% of that is then channeled into the health programs. But this most recent one, it's 100% that Indonesia invests into its health programs through, of course, the Global Fund mechanism. Now, this upfront cancellation is also very important. When we were developing the debt to health swap, we were hearing from partners in the country how important it is to have this upfront cancellation to make it more meaningful as a new mobilized resources going into health. And of course, another part is that it's not creating new mechanisms. Oftentimes when we have debt swaps, the question is where would this funding come to? How can both parties trust that this process benefits, and serves the purpose of the negotiation? So this trilateral agreement really supports that. It's also very important that there's champions to be found. So Indonesia, in its very first debt swap agreement, was a low middle income country. Now it's an upper middle income country, where of course the signaling of debt distress becomes very, very important. It becomes very, very sensitive. And to think about it, you can't be part of a debt swap agreement of this kind if you don't have money to be channeled in, right? So it's actually signaling a strong economy that is ready to service its debt, but because of this agreement, it's being channeled into the global health program. And of course, it's aligning with national strategies, whereas Global Fund proposals, by its nature, has to show that it's aligned with national strategies. The fact that the Global Fund now has this high quality demand arrangement really supports the debt to health program or arrangement in which Indonesia has already put forward, its proposal. Part of it was approved, and then the remaining part gets funded from this expanded resources mobilized by DETA Health. So I think it's really a win for all three parties. And I also want to mention that these relationships within the country itself has increased the cooperation across ministries. Those of us in the health sector know that we're not always top of mind prior to pandemic, of course, top of mind with our finance colleagues. But, in this case, it's really bringing to the table an arrangement that, of course, benefits health, but also is of mutual interest and benefits our Ministry of Finance colleagues.
Thanks so much, Lisa, for this practical experience of Indonesia. And we now turn to Solange. Solange Baptiste plays many different roles, but is the Executive Director of the National Treatment Fairness Coalition. There's also a major role in the Public Investment Network and some other civil society networks. And it's very important, and I'm delighted to have you here, Solange, because it's always emphasized that for all these arrangements with networks, the voice of communities is very important. I'm delighted that the Vice Minister also mentioned that the engagement of society and community is very important, but it is not always practiced. So delighted to have you here, Solange, to share your view on this particular instrument that you are familiar with, because you're also familiar with the governance structure of the fund, where society plays a big role.
Thank you very much, Christoph. It's a pleasure to be here, and I would like to congratulate you, Christoph, on having an all-woman panel. I don't feel at home here as representing a country or representing health economists, but I do feel at home being a woman. I speak here, as Christoph said, on the perspective of affected communities. Those on the front lines of health, where the cost of exclusion, I know we're talking about those that don't qualify as countries, but the cost of exclusion for communities are counted in lives, right? I can tell you that through community-led monitoring, we're seeing the real-time impact of cuts and underinvestment. So we have clinics without medicines, new prevention technologies that just slow now, unpaid healthcare workers, key populations that are pushed out of systems. And these are not just policy gaps, right? They're lives that are lost unnecessarily. Today, we have about 48 countries that spend more servicing their debts than on health or education. And I just want to remind us that it's about 7,000 persons per day die from HIV, TB, or malaria combined daily. And most of these communities were promised that they would not be left behind. These numbers get worse when we layer on climate impacts on health outcomes. So debt swaps, debt to health, not perfect, but they're practical. I think in a world where ideal justice is still delayed, and we heard that at the plenary, we move from this not about money, it's about justice. This conference of FFT is about justice. It's delayed, so therefore practical tools really matter, because the cost of not doing anything is actual people dying. The global debt system is colonial and punitive, and so you can argue that this conversation should just be about debt cancellation. Why are we rearranging furniture to make things work? But we have to do something practical in the meantime, because people are actually dying. I live and sit in South Africa, and the impact of those cuts and the underinvestment is real and palpable. So in this moment, I think debt swaps can offer a real way to redirect debt burdens into shared public goods, particularly in health. So not just a fiscal solution, but a justice mechanism. They align powerfully with the principles of global public investment. As Christoph explained, I work with GPI concept as well. So all benefit, all contribute, and all decide, where debt swaps can embody the philosophy of transforming the creditor-debtor relationship into real partnerships. We often talk about donor-recipient, but I think we can talk about debtor-creditor relationships here. So I have 3 small points on the targeting imperative that you asked. So for these swaps to work, we hear about Spain and Germany speaking, Indonesia as well. This has to be truly country-owned, But I would like to add that it needs to be rooted in community realities. So country owned, but community driven. And when I say community, everybody will say, well, what do you mean by community? I mean affected communities, right? Not generic civil society. So we already have the data, community-led monitoring, the country coordinating mechanisms that have been brought up from the Global Fund give us a clear map of where the needs are most urgent. So where are you actually going to put the money? I think is really critical and will save lives. So this data should inform what debt swaps are used for, not just track what happens after the money moves. Secondly, I'd say that we don't need to invent new programs. We can fund what's already approved and under-resourced, as Peter and others have mentioned. The unmet quality demand. These are high-impact programs, pre-vetted and ready to be funded. And last, I think this whole conversation about transaction costs, right, become an excuse. We've seen what happens. I mean, I come from the HIV background. Remember the days when they said people in Africa cannot get ARVs because it's too complicated. Africans cannot tell time. How could these ARVs be taken by Africans? Like, don't use a technical excuse for your lack of political will. So don't let us come around saying that we can't use debt swaps because it's too transactionally high in cost. It's very complicated. How could it ever work for you and your country? Can we get around that and just stop the excuses? So I would say that we should find a way to use debt swaps to move from the promise to the practicality of it. Thank you.
So that's a powerful statement, and indeed, the importance, critical importance of the inclusion of communities is real. It's not just a kind of on top of everything else, but it's very important because that's also other financing mechanisms are responding. We learned with debt swaps you have to be flexible. I feel as moderator I also have to be flexible, and I want to make good on my promise that there would be comments from the floor, then I have to take it now. So I changed my plan, invite 2 comments and questions from the floor, and then all of you will have a final kind of statement before our co-hosts will do the closing. So that's a slight change in plan. And I would first talk about Charles Erhardt. Charles Erhardt is the Chief Strategy and Impact person at the Green Climate Fund, another one that has experience with debt swaps, but from a slightly different perspective. We heard also about, of course, Germany, Spain, others that swaps are applied in all sectors, and climate and environment is very important. So, brief comment from you, Charles. And if there's a second, okay, you get the second comment on that.
Yeah, climate and health in this case. I just want to share an experience with the GCF from Barbados and link that into the opportunity, I think, that is presented and the value add to the ecosystem that is presented by the establishment of this hub. So GCF the GCF board recently approved a debt for climate action swap with Barbados. And this was a first of kind link with resilience. And part of, I think, what was interesting that I wanted to share was the way that this was stacked up. This was a 40 million grant from GCF, plus a 30 million concessional loan. Then bringing in EIB, plus Inter-American Development Bank in this partnership. This created, with their debt swap, that created 125 million in fiscal space for the government of Barbados in combination with the grant and loan from GCF to rehabilitate critical water, sewage and treatment on the island. And the important thing about that 125 fiscal space is that for that water sewage solution, reuse, it's not just about building it, it's also about maintaining it. And the maintenance of these kinds of facilities over time is critical, and part of why they need to replace the current one if it wasn't adequately maintained. So what I think is valuable to draw from here is how these different instruments can be brought together for a solution that meets the priority needs of the country that cross-cuts climate change, health, food security, and water security concerns. And there's a but. And the but is that the transaction costs were awful, right? But it was the first of kind, right? Looking through this. So this just brings me back to this comment on the value of the hub. These kinds of complex solutions in many cases are what countries need. But we've got to be able to learn from them collectively so that we can replicate. And I think the hub has got a really high value role to play in making sure that over time we can reduce those transaction costs.
Thanks, John. It's great to hear that experience of doing climate fund. I may already have a wish for the future. I would like to see that for the future that is going to technical climate fund. So why not do that? So over to you, please introduce your group.
Thank you. My name's Sunny Nagri. I'm from Results UK and also affiliated with the University of Sussex. So just a brief comment and then a question. So I was really pleased to hear Peter and also Solange say that debt swaps will not address debt crises. So to address and prevent debt crises, we need structural change, and that's why it's a tragedy that the UN Framework Convention on Sovereign Debt does not appear in the compromiso, as it was opposed by many global North states. Only structural change, including but also beyond debt, will enable global South states to properly and sustainably fund, for example, TB prevention, diagnosis and treatment. This was only 26% of the $22 billion required in 2023, and it's worth noting that these figures don't include TB R&D, which proportionally is even more poorly funded. So this is my question. Following on from what I've just said, debt swaps, I would say, are most suitable for states with low or moderate debt, not those in debt distress. And for such states, that is, those with low or moderate debt, for such states with democratic accountability regarding public expenditure, why not just provide debt relief, which is less paternalistic and more straightforward? So in other words, aren't debt swaps really most suitable for states that have both low and moderate debt and also lack that democratic accountability regarding public expenditure and financial management? Thank you.
Thanks a lot for that comment. So now back to our panel, so that you can combine your second comment with the final comment, if you like, because then we will have closing two rows after that. So maybe more 2 minutes than 3 possible. But your vision on next steps, on kind of the future, where do we move from here? And first, back to you.
Well, thank you. Very brief on my side. I think it was just mentioned by Charles about the importance of learning. That's what the hub wants to provide. And I wanted to mention that yesterday we approved in Spain a national framework to provide an additional 300 millions in the next 5 years in bilateral swaps to convert existing debts into development investments. And we did that inspired by Germany. So, I mean, all our experience is also based on what we are learning from our own experience and from other organizations and just looking at other countries, what they do. It's not about inventing the wheel. So Spain is the leader in presenting the hub, but it's not our hub. It's intended for everyone to be there and because we all can provide something for that. And so we will be more than happy to have as many stakeholders and participants as possible to build really something that is impactful. Please.
Thanks so much, Ines. Very impressive. I think we're all delighted to hear. We know you're already putting, I think, 3 million euro into the hub itself.
For technical assistance.
Yeah. And now on top of that, Spain approved 300 million for additional debt swaps. Fantastic. Thank you so much. Martina, you also said you wanted to keep your kind of comment on the hub, for your forward-looking, and now we've heard that there's a more here. Over to you, Martina.
Thank you so much. And yes, first point I would like to make, looking at the future, we will definitely continue to provide debt swaps. We just agreed on a new debt swap policy last year, which provides a bit more flexibilities than we had before. Don't have the time to go into details, but we'll continue to do so. And I think one of the constraints we face is exactly that the mechanisms we have are complicated sometimes. They need to be complicated, but therefore it's so important. I really would like to congratulate Spain on this initiative, which of course, what matters is that many join, because what it is about is to share experiences, to share knowledge, and to make things simpler, replicable was the word that was used. Because I think I said that we have to, these are the times where we really have to make the most of every euro we have, every dollar, whatever we have. We need to be creative, we need to be flexible, we need to be innovative, and simplifying can be a way out. Just one example, Germany has engaged in an initiative on blended finance. Just a year ago, we presented this year also, and we were thinking about how can we scale up in these times. And talking to the private sector, we found out that simplification, standardization is a prerequisite for many, because many do not invest because it takes too long, it's complicated, it's what we hear. This is a different story. I think here we cannot end up with a standard of swaps, because swaps policies are very closely related to budget policies, which are very different in each country. But I think we can set up certain criteria, we can learn from each other, have a kind of pool, we can pool not only resources but knowledge. I think this can be a game changer in order to scale up financing for debt to health and debt to other issues, debt to other areas. This is the second point I want to make. Again, this is also about I think what very much matters, and I would like to support what GCF just said, is to engage in climate swaps. This will be something we are looking into very closely. And my third, I have 4 points I want to make, is that indeed it's not only about learning, it's about cooperating, aligning, and I think the international organizations, the funds have a role to play here. So I fully support what you were saying. And again, then coming back to the question also related to the overall debt situation, one element of our new strategy, this is also something we can talk about when we join forces, is that we build in flexibilities with regard to countries which face shocks. We all know about hurricane clauses in certain debt settings, and so I think this is also something we can think of, how to speed up and use the debt swap instrument in these kind of catastrophic situations. And coming to the overall debt situation, of course, we would not engage in a debt swap in a country with a difficult government situation where we do not have a sound financial and debt policy in place. Thank you very much.
Thanks, Martina. And in this case, I have to come back with one additional question, because you mentioned the simplification.
Yeah.
And that is core of what we wanted to discuss, right? I've been a long time advocate for debt swaps, but one of the main counter arguments I've heard over the years is it's too complicated, it's too complex. Martina, would it be fair to say that as a government like Germany does, repeated debt swaps, is it getting simpler? Can one say that if you gain experience with that makes that simpler? And would also be fair to say if another government wants to start, with that mechanism, could there be lessons learned that make it faster and easier also for others? Because the challenge is if everybody starts from scratch, then we have a challenge. It takes time. Is that true? Is there simplification over time?
Thank you for posing that question, because it's very relevant. Yes, of course, it's getting simpler every time. We're learning in our ministry, we're learning in the government, because each debt swaps involves a couple of ministries. We have to engage with Ministry of Finance, we have to engage with Parliament, parliamentarians know the instrument at this point of time. So there's no blueprint. That's what I said. We can't standardize, but we can speed up and simplify by learning from experience. And that's why this happens so important.
Thanks a lot, Martina. And a similar question, of course, to you, Lisa, from the side of Indonesia. Is there a learning over time that makes it simpler? Or how we do assess that? How complex was the last swap? And can that be made simpler over time?
Thank you, Christoph. So if we look at the 4 debt swaps that have happened under this trilateral, you can see that the process has become even more aligned in terms of the negotiation process. There's more trust across 3 parties, of course. The process is actually faster. The last one, I believe, was much, much faster, not only across governments, but also within the government itself, between Ministry of Finance and Health, because for health, we have to wait for that negotiation to happen to then have it channeled into the health program. So yes, once it's running, it's very much easier in a sense to build up on it and really finesse that process. So I think that's really something to highlight there. And perhaps going into the final statement, I'd like to touch a little bit on that second comment there. So debt restructuring is important, of course. Many of us agree on that. There are forums for that, of course. For instance, the Paris Club, etc. But here, I think the conversation really is about middle-income countries that sort of are stuck like a middle child. We're not low income enough to qualify for a lot of aid, but we're not also sufficient enough to be self-sufficient in terms of income level. So debt swaps really is addressing this need for middle-income countries. Now, I'd like to say that debt swaps are not only innovative because it's a different kind of source of income, but it's also because it's clever and it works. And we already discussed a lot about that. What I'd like to close with is that I'd really like to ask this trilateral arrangement be expanded to other sectors as well. So yes, health, yes, TB, AIDS, malaria, but also let's look at other areas, other sectors in each of our countries which have high quality demand, whether that's in the form of proposals, perhaps already agreed programs that's aligned, of course, with the national strategies, and then see how can there be conversation between the sectors in the country with the finance parties in the government, and see where we can mobilize resources, expand not only fiscal space but also close the gap in the need for development programs.
Thanks, Lisa. Very helpful. And your vision for the future for this industry.
Thank you. Thanks, Christoph. Just to add on to the question that was asked, I just wanted to say that we've said it before, but debt swaps don't fix the debt crisis. But we've heard from the panel, we talk a lot of the conversation has been on efficiency. And I think we need to just call it out that debt swaps focuses on efficiency, not on justice. So if you're looking for a justice fix, debt swap is not where you need to go shopping, right? So we talked about the hammer looking for a nail to hit. Let's just get the right tool. So if you're looking for a justice solution, I don't think that debt swaps we'll come back to these counter arguments. But that doesn't take away from the practicality and its use and its for today and the immediacy of the urgency of the deaths that are happening on the ground and the realities there. So for the future, I would say, look, Christoph, I think we should have communities that remain at the center. We need to have them built in the design and implementation and accountability, not just as an add-on. And I think really that debt swaps can shift the power. They're not just financial mechanisms, but if done right, they can really challenge the outdated models that we have. And it is really about this all decide principle. I really want to get back to that, where there's transparency and ownership. These are not just buzzwords anymore. We have an opportunity here where we can use them so that we can use what we have in front of us better, faster, and more justly. I think the gap isn't the money or the ideas, right? We have lots of those. We're here, and every session we go to, we hear something. It's in the courage to shift the power, right? If we don't change who decides, we won't change what gets done. We'll just be having the same conversation the next 10 years, saying, oh, we should have some debt swaps. And my final thought is, yes, okay, we're not in an ideal world, but we are in a world where there are tools, there's community data, there's all kinds of data, there's opportunity. So let's not let complexity become the excuse. And we know that debt swaps is not the destination. They are a bridge between what is, I think we could say, is broken and what is possible. And I think the real risk is not the transaction cost. The real risk is inaction.
Thank you. I love that. That's absolutely true. Thank you very much for that statement. Thank you all the panelists. I thought that was a very thoughtful and inspiring conversation. You're welcome to kind of move back to your seats, but a big round of applause for and for that, I would like to ask our two speakers for closing to the podium. Director General Seville, would you like to join me here? Peter Sands from the Global Fund, you will do a few closing remarks as well. Please see it here. I think you want to go first. Yes. Right.
Oh, we ready?
Yes. We'd like to have our two co-hosts here again on stage. We heard a lot about Indonesia's experience. I think very inspiring for many of us here. So happy to give the floor to the Director General of State Assets in the Ministry of Finance of Indonesia, Silman.
Thank you. Peter Sands, the Executive Directors of the Global Fund, Dr. Prof from the Yuklanga Institute, distinguished speakers and also participants. I think as we conclude on the today's important side event, let me begin by extending my deepest appreciation to our speakers and also participants. Your insight and engagement underscore the critical importance of exploring innovative financing to meet global challenges. I think drawing from the discussion that we have, several key actions emerge, such as in simplifying and standardizing the agreement, the debt swap agreement, streamlining the processes of, in order to lower costs and also improve coordination, ensuring national ownership by aligning swaps with the country priorities, as well as enhancing transparency and engaging civil society to support implementation. I think today's discussion show that debt swap can be very powerful to address the urgent global challenges. And with that, now is the time to turn our shared momentum into action. Thank you, Dobio.
Thank you so much.
Thank you very much. Look, I think this has been a very high quality discussion about a tool that can deliver very tangible benefits, but to the questions that have been raised, they don't solve the entire problem. And nobody should pretend that the entire problem of excess debt in many of the poorest countries in the world is going to be tackled through debt swap. I would also, as a banker, just to be controversial, say debt relief is enticing. Debt relief is also a short-term solution because many of the countries who are getting debt relief have been there before, and there's an underlying problem that we need to solve if we really want to tackle it. But none of that should take away. We can't let the best be the enemy of the good, which is the good here is that we can deliver a lot of very tangible health and development benefits in a relatively short term by working with creditor partners, sovereign creditor partners, with implemented partners, and making things happen. On the complexity of transaction costs, and I think they're very interconnected, a lot of this is self-inflicted. We don't have to do it. We have made a decision. I mean, for example, one of the complexities we've encountered is the application of anti-money laundering laws to debt swaps. This is a unintended consequence of bank regulation. And it's really actually quite difficult to comply with them when you're thinking about the provision of antiretroviral treatment in rural health clinics, right? It just sort of doesn't work. So there are things we need to clean up. I'd also argue, if you're looking at public market debt swaps, the Basel III capital treatment of guarantees is inappropriate for those purposes. So there's a bunch of technical things there where I'm hoping that the hub can get into some of this, because the more we can simplify and standardize and say, if this transaction meets these kinds of parameters, we don't have to do this, then it makes the whole thing much smoother. And I'll take Solange's point. Transaction cost thing shouldn't be too much of a focus, and it shouldn't stop people acting. But on the other hand, every dollar spent on the intermediary costs is a dollar taken away from the ultimate benefit. And we do want to make sure we maximize that flow through of the dollars to the people who need it most. So I come away from this saying, look, we've got a tool. We know that the amount of sovereign bilateral debt to low and middle income countries out there that hasn't been swapped is still a very big number. The more of that we can turn into benefits for people who need it on the ground, that is so desperately needed right now, and we should try and make that happen. And just one last point. To the point on middle income countries that was very powerfully made, I do think the language is wrong here. We talk about middle income countries as if there's some way in the middle between low income countries and high income countries. But the math doesn't work like this. The boundary between low middle income and high middle income is just under $5,000. The average per capita income of the G7 countries is between $55,000 and $60,000. So a low middle income project isn't kind of in the middle. It's got 10% of the money, less than 10% of the money of a high income country, and a low income country is far further down the line. So I think it's a little too easy, and you see these in some of these discussions about graduation from overseas development assistance is, oh, they're middle income, they can now pay for everything themselves. They are still massively poorer than your average high-income country. And we just need to keep that in perspective when we're thinking about these sorts of tools, which I think, as you said, are particularly important for middle-income countries. Thank you.
Thanks a lot. Thanks for all of you for coming. Happy that it goes roughly on time. Thanks so much for the very powerful closing statements of panelists. Wishing you a nice day at the conference.
Thank you very much. Thank you.